Hi to all my Discovery members. Welcome to your 2022 changes. There are a lot more changes around the sort of the peripheral benefits rather than the actual plans themselves. And then I also want to chat to you about the changes in the premiums. I'm just going to switch off this video so that we can have some more bandwidth. Right, let's have a look at what we're going to go through during this video. I'm going to have to motor it a bit because there's quite a lot of information. But we're going to look at the premium increase strategy for Discovery for this year. We're going to look at some of the enhancements. Then we're going to look at something called Discovery Hospital, which is a new thing for 2022. And in addition, there's a digital patient community platform that will help specifically those with cardiac problems and also diabetes. So yeah, we'll get to that at the end. Just quickly, we're going to get some understanding of the components that make up the medical inflation. So why the increase is what it is every year. If you look at tariff inflation, I'm just going to get my little Gucci so you know where I'm talking. There's my tariff inflation. This is where the cost of doctors' consultations, the cost of medication, the hospital ward fees, those kind of things go up as they do every year. Then we're looking at demographic risk, and this is essentially where every year your book of clients, everyone gets older, and therefore you're more likely to have claims. And also people joining the scheme can also have more chronic diseases. And that would obviously increase the risk of the medical aid. I'm just going to come to this side, and there's also something called utilization changes, where COVID is a really good example where people have been very frightened of coming into hospital to have their normal investigations or joint replacements or whatever operations that they need. And although COVID has had hospitalizations as well, it has reduced the normal cost per year of people going into hospital. So those things can change, but Discovery seems to be quite positive that things are going to start to return to normal by the end of 2022. So they factored that into their premiums. And then lastly, there's a managed care, wellness and other interventions where they reduce the inflation by looking at things like negotiations with hospitals for lower tariffs, case managers, making sure that people aren't being admitted to hospital needlessly, and then lastly the fraud that Discovery has been doing a lot of work on fraud prevention, which is great for the rest of the members. So the strategy for them is to look at the tariff inflation, which they estimate will be a 4.4% year on year, a demographic risk of about 3%, utilization changes of 1.5. Now, if you add those up, it comes to more than what they've actually increased it for. And then the risk management, which should reduce the premiums by 1%, but they've decided on a medical inflation rate for 2022 of 7.9%. And that is only going to be from the 1st of May 2022. So we're missing the first third of the year where we're getting a premium increase holiday, as it were. If you're interested, that means an effective increase for 2022 of 5.3%. But I think this figure is more relevant in that is what your premium will go up by on the 1st of May. Right, so let's have a look. I'm just going to choose a few examples here. We can't go through all of them, but if you are really interested in finding what your increase is going to be, then just pause the video so that you can have a longer look at what's going on. Let's look at Classic Comprehensive. For the main member, currently it's 4,732 plus the 1,577 that goes into the medical savings account, giving you a total contribution of 6,309. That is just for the main member. Then if we look at Coastal Saver, which is, I have a lot of clients on Coastal Saver, we're looking at 2,211 for the premium, 552 for the medical savings, giving a total contribution of 2,763. Now that's what it is currently and what it will be from January to April in 22. Here's some more. Let's just take a key care. Let's say somebody who's in the second band of key care, 8,551 to 13,800 salary. You'll see these figures haven't changed from this year. That's 1,758 just for the main member. There's obviously no savings account on this traditional plan, and then so that the premium is 1,758, or the contribution is 1,758. So that should be pretty clear. Now let's go look at 2022 from May onwards. Let's look at the same ones. We're looking at classic comprehensive. It's now 5,108 plus the 1,702, sorry, for the medical savings, giving total contributions of 6,810. The coastal saver now goes to 2,387 plus the 596, giving a total contribution of 2,983. For the key care on the second band that we looked at previously, it now goes up to 1,897. Obviously no medical savings on this plan, giving you the total of 1,897, just so that you have some idea of what the increase is going to do. And just to remind you, this will be for the 1st of May. We're going to take a look at the enhancements now, and I'm going to start with the assisted reproductive therapy benefit, only available to those on comprehensive and executive. I'm not going to go through it in huge detail, but just to say that they have improved the benefits. There's cover for freezing of embryos as part of an IVF cycle. There's also cover for egg donated cycles, including donor matching fees. There's a cover for egg donation cycles, and that will be extended to include members aged 43 to 50. So if you're keen to have a little one at your age 50, go for it. Qualifying members who are registered on the scheme oncology program. And this is quite nice because people often are quite young when they get their oncology diagnosis, and they want to freeze the embryo so that they can still have children in future, as the treatment might actually damage that possibility. And they will store the eggs and sperm up to 5 years. All benefit enhancements are subject to the overall assisted reproductive therapy benefit of 115,000. It must follow the SASREC guidelines, and members will be responsible for 25% of the cost and any excess over and above the Discovery Health rate. Enhanced palliative care offerings. Currently the scheme provides a separate cover for palliative and end of life on some of the plans, and what they've done is they've amalgamated them now, so there'll just be one palliative care offering. And it's really good that it's now across all Discovery Health membership benefits and plans. So even the key care will have this as part of their plan. And then from January, the scheme will merge the compassionate care program and the advanced illness to provide members with a single and holistic benefit. Okay, so you will get that benefit even for those who are not affected by oncology per se, but have an advanced illness that is likely to lead to death, and then cover is subject to authorization and approved treatment guidelines. There's also been an enhancement to the oncology benefit. So some of the treatment, especially the very expensive treatment, has only been available on the comprehensive and executive plans, but they've made some of those now available to the lower end plans, such as cancer therapy for immunotherapy, biologics targeted therapies of cancers, and precision oncology medicine. And it's covered currently by the innovation benefit, as I said, on those two top plans. Cover will be at 50% of the Discovery Health rate with a 50% copayment by the member. So this immediately makes me think you need to check the gap cover as well, just to make sure that they will cover this 50% for you, for those of you who have gap cover. And then we're going to look at the enhanced allied therapeutics and psychology extender benefit. It's a well-known fact that a lot of mental health issues have now arisen because of COVID and all the stuff that's happened around that. So medical aids are looking more to the mental health. So cover will be extended to include the treatment of moderate to severe strokes and head injuries. and there's also a 2-year cover period will be removed for certain conditions, effectively negating people having to reinstate every 2 years if they're still suffering from that condition. And the conditions affected are hemiplegia, paraplegia, and for me, really importantly, the speech and swallowing disorders that you get with strokes and head injuries. Right, I've just had a check of the time, and I am running out of time. I still have a few slides to go. So I'm going to stop it here, and we'll do a second video that will just take you through the rest of the slides.